David Rosenhan's controversial psychological experiment, known as the Rosenhan Experiment, was a landmark study that questioned the validity of psychiatric diagnoses. Conducted in 1973 and published under the title On Being Sane in Insane Places, it had significant implications for the field of mental health. Rosenhan aimed to test whether mental health professionals could reliably distinguish between sanity and insanity. Rosenhan and 7 other pseudopatients presented themselves at psychiatric hospitals, claiming to hear auditory hallucinations such as the words empty, hollow, and thud. Aside from this fabricated symptom, they behaved and answered questions truthfully about their personal lives. Once admitted, they acted completely normal and reported no further symptom. All 8 pseudopatients were admitted to psychiatric hospitals, mostly diagnosed with schizophrenia. They remained hospitalized for an average of 19 days, with one staying as long as 52 days. Despite behaving normally inside the hospitals, staff continued to treat them as mentally ill, interpreting their normal behaviors as symptoms of their supposed illnesses. Rosenhan noted dehumanizing treatment of patients, lack of personal care, and an over-reliance on labels like schizophrenia in influencing staff perceptions. The experiment highlighted the subjectivity in psychiatric diagnosis and the impact of institutional settings on both patients and staff. Critics argued that deceiving medical professionals was unethical and potentially harmful to real patients needing care. Some questioned the reliability of Rosenhan's methods and data collection, claiming his conclusions might have been exaggerated. A second part of the study, in which Rosenhan challenged hospitals to identify pseudopatients without actually sending any, revealed false positives, further illustrating diagnostic uncertainty. The Rosenhan experiment sparked widespread debate about mental health care and contributed to reforms in psychiatric practices. It remains a pivotal case in psychology, illustrating the complexities and challenges of diagnosing and treating mental illness.